No one is diagnosed with cancer without first having tests performed by the lab. Dr. Scott Kerrigan, a North Bay native, is one of 5 doctors who does that type of testing.
We do inpatient and outpatient work, so we provide pathology services for the hospital and then for the physicians in the community and the surrounding area from West Nipissing, Mattawa, and up towards New Liskeard. So it's hospital-based lab medicine and community lab medicine, so supporting the family doctors or surgeons' offices in the community. And I'm a general pathologist, and that's any sort of lab testing, lab medicine, from screening tests for cancers, things like pap smears, biopsies done as part of the mammography screening program. A lot of this work is screening, looking for cancers. You would hope to find them and prevent them really before they get a chance to get established. So that's kind of the idea of screening. So we do a lot of that work. And then related to that also then is we sometimes do diagnosis of cancer. So the patient already suspected to have cancer. Maybe they present with a mass and the surgeon will take a biopsy. They'll send that to us to find out if it's a cancer and then what type of cancer it is and maybe what factors or features that we can see that will predict the best treatment and also the prognosis. And once patients are diagnosed, then they often need further tests, if they're treated, to look to see if they're responding to the treatment, if there's been a remission of the cancer. And sometimes the follow-up is many years for these patients, and they're often looking for recurrences if something develops in the future. So once they're in our system, so to speak, we often follow these patients for many years.
Vicki Tourville works hand in hand with the doctors when it comes to microbiology. Her role is vital as well.
If a cancer patient has surgery and they have an incision, there's a possibility of an infection in that incision. So we don't want anything happening right from the start. So we want to make sure that if there's an infection, we diagnose the organism found and we get the right antibiotics going for that patient. So we work hand in hand with the physicians for that. The second time you will see cancer patients being treated in microbiology is when they're having chemotherapy and their white blood counts drop. They're very susceptible to infections. They're susceptible to pneumonia, and that can sometimes lead to an infection in the bloodstream called sepsis. So if that happens, we have to identify that organism quickly and make sure they're on the right antibiotics.
And the best way to treat patients is by keeping them in North Bay. The less travel, the better chance they have to get to better health more quickly.
For the coordination of care, all the care providers in this community know each other and work well together. So it's important that all the pieces are available here so that the people can work as a team in a more cohesive manner rather than say, well, you have to travel to Ottawa or Toronto for your diagnosis. And then there's a disconnect between the place where the diagnosis is made and maybe where the treatment is happening.
A healthy lifestyle did not preclude Linda Vanderschaft from getting cancer. She had multiple myeloma. Right now, she's winning the battle.
With the help of my physician, you get as much information as you can. It was about how long am I going to live. There is no cure for multiple myeloma. There's more and more treatments coming out for it, but there is no cure. I'm in remission right now.
But what isn't in remission is her desire to reward the foundation through payroll deductions to help them get better equipment and offer better care.
And it's been a pleasure to donate through my payroll deductions through my employer. I've been involved with the run. I don't run, but I walk when they have their walk in the fall. Did a fundraiser at work recently where we cut some hair and raised some funds for the foundation again. And I'll do whatever I can to support the foundation and the work that they're doing.